It is basically a little bit of each body system from head to toe. So if you think of it that way, and you're thinking about the abdomen, what am I assessing with the abdomen? What basic information do I need? Same with the heart, same with the lungs, same with the mental status, the skin, hair, and nails, neurologically, and we don't go into a great deal. It's just an ongoing assessment, gives us a little bit of information about each body system. Please don't use this ongoing assessment as a check sheet. I encourage students not to memorize it, but to think about what you're doing with that assessment. So, okay, what's the first thing I do when I go into the room? Okay, think about what you have to assess with the heart, what you need to assess with the abdomen, just to give you enough information, okay, to proceed. So, you'll have a case study in DocuCare for your ongoing assessment. We'll give that to you a few days ahead of time for you guys to review it. The patient will have a true diagnosis, okay, a true admissions history. So please review it, and what could you anticipate if it was a respiratory patient? What might you anticipate if it was a cardiac patient? Okay, so I want you guys to start thinking about those disease processes that go with each body system. Like today we talked about emphysema, we talked about COPD, we talked a little bit about pneumonia. Think about those things, okay? So, guys, and I break out in sweats too and get really nervous, so, okay. So, this is a simulation. We'll most likely have one of our 3G simulations. The patient could be male, could be female, and you're just going to go in, do the same safety routines that you did with your patient during your pain communications assessment, okay? So now I'm going to pretend like 24 students aren't behind me. So,
come in.
So I'm going to open up the, I'm going to keep the curtain closed. Hi, Mrs. Montroy, my name's Susan, and I'm going to be your student nurse today. Is this a good time to visit with you?
It is, actually.
Okay, good. So I'm going to open up the curtain, I'm going to step inside, I'm going to shut the curtain, I'm going to write my name up on the board. So Mrs. Montroy, like I said, my name's Susan. I'm going to be your nurse today. So first I've provided privacy, shut the door, pulled the curtain closed. I wrote my name up on the board. I'm going to wash my hands. And first I'm going to do my patient identification. So I'm going to come in with my DocuCare. I have the electronic medical record all opened up. So Mrs. Montroy, I'm going to go ahead and check your identification. And I'm going to look at your armband. And I see that my medical record matches the patient's first name and last name. The medical record number matches my electronic health record. And I see that she does not have any allergies. So can you tell me your full name?
Yes, it is Jan L. Montroy.
Okay, very good. Can you tell me your date of birth, Mrs. Montroy?
9/23.
Okay, perfect. And that matches your identification bracelet as well. So today we're just going to do a complete head-to-toe physical assessment. Is now a good time for you, Mrs. Montroy?
Oh, I think so.
Okay, very good. So, I see that Mrs. Montroy is awake. She's alert. She's told me her first name. She's alert to person. Can you tell me where you're at today, Mrs. Montroy?
Well, I'm in the hospital.
Okay, very good. She's oriented to person, place. Can you tell me the month and year?
Yes, this is September of 2015.
Okay, perfect. And can you tell me who the current president is?
President Obama.
Very good. So patient is alert. She's oriented to person, place, time, and situation. She appears well groomed, dressed appropriately for the occasion. Her mood, her affect seems to be appropriate. She's responding, asking questions, answering questions appropriately. She seems to be cheerful. And so I have mood, affect, her dress. She appears clean, good hygiene. And so now, first we're going to just go ahead and move on to our exam. The first thing, and I'm going to go ahead and come over to the other side of the bed. First thing I'm going to do, Mrs. Montroy, is I'm going to check for your pupil dilation. So I'm looking at my pin light. I see that both of your pupils are about 5 millimeters. Now, what I'm going to do next is just shine a light in your pupil, and I want to see that it constricts, okay? So if you'll just look directly up to the ceiling. Okay, so pupil constricts from a 5 to a 2 millimeter. And now your left eye. Pupil constricts from a 5 millimeter to 2 millimeter. Reaction is brisk and equal bilaterally. Okay, so now I'm going to go ahead and check your upper extremities. I'm going to take a peek at both of your arms. So skin is beige with pink undertones. Skin is warm, dry bilaterally. Skin turgor with good return of elasticity to the skin. I'm not palpating any edema, so I would rate that at a 0. I'm going to check your pulses, both your radial pulses in your right and left hand, regular rate and rhythm, 2+, strong bilaterally. I'm going to go ahead and check your capillary refill, and I'm just going to be pinching all 10 of your fingers. Capillary refill is less than 2 to 3 seconds in all 10 fingers. Okay, so let's see. Oh, hair distribution is equal bilaterally on both arms. And now we're going to check for your strength. So, Mrs. Montroy, as I push up against your hands, I want you to push down. Okay, very good. Now, I want you to do just the opposite and pull up towards your head. Okay, so flexion and extension is equal bilaterally. Can you squeeze my hands? Grip is strong. Now, Mrs. Montroy, can you tell me if you have any tingling or any numbness in your upper extremities?
I don't feel any.
Okay, very good. So no tingling or numbness. I think that completes our upper extremities, her neuro assessment. So now I'm going to move on to your respiratory status. So I'm going to take a look, and once I get to the heart and lungs, I'm going to assess your vital signs. And you can do this when you first come into the room. You can do it in between your assessment. But I see that your respiratory rate is at 18. You have an equal rise and fall of your chest. Your rhythm is regular. There's no use of accessory muscles. And your pulse oximetry is at 95%. That's normal. Your heart rate is 80, and that's normal. Your blood pressure is 134/78. So I'm going to go ahead and take that again just so we can compare the readings. And this is where you're just going to physically touch the monitor, and you're going to compare both of the readings from the previous to your current blood pressure. Your temperature is 98.1, so that's within normal parameters. So I have one more question for you with your vital signs. Pain being the 5th, can you rate your pain on a scale of 0 to 10 for me? 10 being the absolute worst pain.
Oh, I'd say maybe 1.
Okay, okay, and can you tell me where your pain is at?
I've got just a little bit of arthritis in my left wrist. It bothers me
Okay.
once in a while.
Okay, thank you. And is that a constant pain?
No, it kind of comes and goes.
Okay, okay. So pain scale of a 1 or 2, did you say?
You
In
know what,
your
right
left
now
wrist.
it's about a 1.
Okay, good. I'm gonna make note of that. And over the period of your stay here, we're gonna do a thorough pain assessment and probably have a closer look at your wrist and that arthritic pain. So now I'm gonna go ahead and move on to your respiratory system. I've watched your respiration rhythm and rate. I'm gonna go ahead and auscultate your lung field. So Mrs. Montroy, if you don't mind, I am just going to be listening to the anterior portion of your chest, and I will expose as little as possible as I'm auscultating your lung fields. So with the diaphragm, her right upper lobe is between the first and third intercostal space. So Mrs. Montroy, as I listen to your lung fields, each time that I move my stethoscope, I would like for you just to take a deep breath. Left upper lobe between the first and fifth intercostal space. Okay. And then right middle lobe between the fourth and fifth intercostal space. And then left lower lobe between around the sixth intercostal space. And then I'm going to listen laterally. So right lateral lobe. Sorry, and my right lower lobe was at the sixth intercostal space as well. Right lateral lobe is at the eighth intercostal space. Left lateral lobe, left intercostal space, 8. So all lung fields are clear to auscultation, and there's no adventitious lung sounds. So now, while I have you in a comfortable position, I am going to go ahead and listen to your heart sounds, okay? I'm going to be listening to 5 different areas. So I'm going to be listening to the aortic, the pulmonic, the mitral, and the tricuspid, the aortic, pulmonic, tricuspid, and Erb's point and mitral. So your second intercostal space, right sternal border, I'm going to be listening for at the aortic for 1 regular S1, S2. So heart rate, regular rate and rhythm. Pulmonic is at the second intercostal space, left sternal border, regular rate and rhythm, normal S1, S2. Third intercostal space. Is your Erbs or tricuspid? Erbs. Erbs? Tricuspid.
Erbs is down.
The third intercostal space is the tricuspid, S1, S2, present. Erb's point is the fourth intercostal space, left sternal border, S1, S2, present. The mitral is your fifth intercostal space, and that's at your left mid-clavicular line. So directly down from approximately the nipple line, and this is at the apex of the heart. And this is your main apical pulse, if you only have to listen to 1 heart sound. Regular S1, S2 present. Okay. So now we're going to go ahead and move on. We're going to be covering the abdomen area. So I'm going to go ahead and lift up your gown from the bottom. And I'm going to just first inspect your abdomen. And I see that your abdomen is flat, round, symmetrical on both sides. There's no rashes, there's no lesions. I'm not assessing any scars. And, oh, I forgot, your upper extremities. They're not only pink or beige with pink undertones. I'm not seeing any rashes, any lesions, or scars on your upper extremities as well. Okay, so now I'm going to be listening to your vowel sounds, and then I'm going to be palpating. When I palpate or press on your abdomen, I would like for you to tell me if you're having any pain or discomfort, okay? And then lastly, I'm going to be listening to your aortic area for any abdominal aneurysm. And this is just specifically looking at or listening for any bruits, okay? Oh my goodness, now, one thing I forgot. Mrs. Montroy, oh my goodness, I'm so sorry. I'm going to go back up to your heart, okay? So now, we listen to the aortic, pulmonic, tricuspid, Erb's point, and mitral with our diaphragm. We are also going to listen with our bell. Now we listen for our bell for any heart murmurs, rubs, or gallops, okay? So I'm going to listen to the aortic, again at the second intercostal space with the bell of my diaphragm, the pulmonic, second intercostal space, tricuspid, third intercostal space, left sternal border, Erb's point, fourth intercostal space, left sternal border, and then your mitral area is your left midclavicular line, fifth intercostal space, and all of that sounds within normal parameters. I am not hearing any murmurs. Okay, so let's move on to the abdominal assessment. Can you tell me the last time that you had a bowel movement, Mrs. Montroy?
Oh, I think this morning.
Okay. Now, do you usually go once a day? Is that pretty normal for you?
Usually.
Okay, very good. And then when was the last time you urinated?
Oh, that was about an hour ago.
Okay, perfect. Okay, thank you. So now I'm going to listen with my diaphragm. I'm going to start in the right lower quadrant, and I'm going to move clockwise. So right lower quadrant, normal gurgles and clicks every 5 to 15 seconds. Right upper quadrant, normal gurgles and clicks every 5 to 15 seconds. Left upper quadrant, normal gurgles and clicks, one every 5 to 15 seconds. Left lower abdomen, normal gurgles and clicks, one every 5 to 15 seconds. Okay. So now I'm going to turn my diaphragm over. Right at the umbilicus and up, I'm going to go a little bit to the left. I'm going to listen for my bell for any swishing or a brewing. I do not hear any aortic brewery. Okay, so now I'm going to go ahead and I'm going to palpate on your abdomen, Mrs. Montroy. As I palpate, it's going to be moderate palpation. I want you to tell me if you're having any pain or discomfort. Right lower quadrant, right upper quadrant, left lower upper quadrant, left lower quadrant. Did you feel any pain or discomfort in your abdomen?
No, but it does tickle.
Okay, it does tickle. So in that case, what you might do is just palpate over your hand, and that way it kind of decreases the sensation a bit, but the patient's still able to tell you if they're having any pain or discomfort. It kind of alleviates the tickling tummy. Okay, so let's cover you back up here. Now, let's see. Cover the intestine, the vital signs. Now, I am going to be assessing your lower extremities. So I'm just going to pull up the sheet and take a peek about from the knees down, okay? So skin is beige with pink undertones. Skin is warm. Even hair distribution. No lesions, no rashes, no scars. I'm going to check for any edema by pressing firmly down on the lower extremities and the upper extremities. And I'm not palpating any edema, so I'm going to rate that at a 0. That's a good assessment. So let's see, equal hair distribution. I'm going to again check your skin turgor. No edema, skin's warm and dry. Now I'm going to be checking your circulation on your feet. So I'm going to palpate your dorsalis pedis. I'm going to palpate them at a 2+. They're strong and equal in both feet. Now I'm going to palpate posterior tibial pulses. Posterior tibial pulses are 2+, equal and strong bilaterally. Now I'm going to go ahead and check some more circulation with your capillary refill on all 10 toes. Less than 2 seconds on all 10 toes. Okay, now, are you having any tingling or numbness in your lower extremities or in the feet area?
Not really that I know of.
Okay, very good. So now I'm going to check your strength. So I'm going to place my hands right at the top of your feet, and I want you to push up just like we did with the hands towards your head, okay? Go ahead and as strong as you can. Okay. Now I'm going to put my hands on the bottom of your feet, and I want you to press down with both feet just like you were to a acceleration on a car. Okay, very good. So equal, strong flexion and extension in both of her lower extremities bilaterally. Okay, so now I think we're finished with that part of our assessment. I'm going to go ahead and I am going to verbalize that I'm going to roll you over, and I'm going to go ahead and check your occipital, your scapulas, your coccyx areas for any skin breakdown. So posteriorly, your skin does not have any skin breakdown. It's all nice and beige and no reddened pressure areas. I'm going to go ahead and palpate your heels. They do not feel boggy or squishy. No discoloration. No non-blanchable areas, so your heels look good. Now I'm also going to check for any IVs. I don't see that you have any IVs in your upper extremities. Is that correct, Mrs. Montroy?
Yes, that is correct.
Okay. And now you don't have a Foley catheter in. I'm not seeing any JP bulbs or anything, no drains or tubes. I think that concludes our assessment. Mrs. Montroy, is there any questions that you have for me?
I can't think of anything. That's about as thorough an assessment I've ever had.
Well, thank you very much. I'll tell you what, usually between my 12-hour shift, I will come in a couple of times and do this full assessment on you. So that gives me a clear picture of your body systems from head to toe. And so I'm going to go check on the rest of my patients, and I will be back and we'll take a further assessment of that wrist that you're having some arthritic pains with, okay?
Okay, thank you.
Does that sound like a plan?
Yes, very
Okay.
good.